We are actually have a trial open, and we're accruing patients now to investigate in a phase 1 trial the safety and efficacy of a relatively new monoclonal antibody called Tafasitamab, which is an anti-CD19 monoclonal antibody that has a potent capacity to activate ADCC through NK cells and macrophages. The rationale, one of the reasons I was driven to pursue this strategy is because of the recent discovery that CD19 is not only expressed in lymphoid cells, but also in cells that are a component of the normal blood-brain barrier. And this is, that work was, the rationale for that discovery was the fact that there's this off-tumor toxicity from CD19 CAR T cells, neurotoxicity from also from CD19 T cell engagers, which seems to be associated with disruption of the blood-brain barrier. So given that, I actually prescribed the story that we published is a case of a patient who had highly refractory secondary CNS lymphoma, refractory to bone marrow transplant, focal radiation, ibrutinib, lenalidomide, and pomalidomide, and had virtually run out of options. We gave this patient Tafasitamab over 2 years ago in combination with lenalidomide, to which he was already resistant. But that patient slowly achieved a complete response and remains in remission more than 2 years later, where by far the longest remission yet achieved. So I've treated maybe a half dozen or more patients with off trial with Tafasitamab, and there's generally, most patients have a response, but now we're formally evaluating in the setting of a phase 1 trial in combination with lenalidomide. The rationale for the co-administration of lenalidomide is that lenalidomide will stimulate the ADCC arm through innate immune cells. We previously have done work with lenalidomide showing that it has activity up front as a single agent and as a maintenance therapy. It's actually a very valuable drug, in my opinion, in this disease. So we're excited about evaluating Tafasitamab. It may not, again, the rationale is that it has direct anti-tumor efficacy and can possibly partially disrupt the blood-brain barrier to facilitate its own entry into the brain and the tumor, as well as potentially facilitate entry of other agents such as lenalidomide. So that we're as components of the correlatives of this study, we're addressing those questions.